Hello everyone, I'm Katerina. Um, my thesis is focused on one of the two criteria in autism diagnosis, according to DSM-5, and that's labeled restricted repetitive patterns of behaviors, interests, or activities. And I'll use the shorthand RRBI for this. Now, the language used here is quite uncomfortable. It refers to restricted and repetitive behaviors rather than, for example, intense interests or seeking sensory experiences. And it really pathologizes behavior without an analysis of what the function of that behavior is or what the meaning is for the autistic person, or in fact, how the context shapes individual behavior. So there's a danger when represented in this way that an individual's needs are framed in terms of whether their behavior fits with society's norms. And this has been emphasized by the neurodiversity advocates. But actually, as a diagnostic criterion of autism, the term RRBIs is also used in research. And that's potentially a problem if you're practicing as an EP and you're questioning the diagnostic term, but you want to consult the literature or contribute to it, as we're encouraged to do. So in my thesis, I focused on the differences between EP practice and research. And of course, this isn't just a problem with RRBIs. In autism research more generally, there's discussion of the research practice gap. And there's a lot on that, which I don't really have time to go into at the moment. But specifically with regard to RRBIs, I carried out an initial search of the literature on interventions, and they seem to largely assume that a reduction in RRBIs was in itself a positive outcome. Whereas as EPs, we tend to think of outcomes more holistically, don't we? So I had, we could move to the next slide. So I had two parts to my thesis. Sorry, could you, I can't see the next slide. Great, so I had two parts to my thesis. One of them focused on the research literature on RRBI interventions, and the other one was focused on EP practice. And now with the literature, I carried out a systematic scoping review. My questions were really, how are outcomes defined? Who has defined them? And I specifically focused on the reporting of children and young people's views, and also on parents and caregivers and teachers as important stakeholders. And the third question, which depended really on the findings from the previous two, was if studies did explore the impact of interventions beyond the reduction in behaviors, were they actually effective? But I also wanted to understand how our RBIs are supported in EP practice, because I think on one level in practice, there's some things that we can state categorically. So, for example, that an intervention shouldn't aim to normalize behavior. You know, there's no ambiguity about that, right? But there are questions that are more complicated. So I think, particularly when a child is young, it's not that easy to define what intervention constitutes supporting a child's development and what intervention constitutes changing the autistic child. So we think, for example, about their ability to understand typical social interactions. You know, what point does skill development actually become trying to change the child? And additionally, I found that research on understanding RRBIs and what motivates them is actually quite complex, and it doesn't really translate clearly into practice. So my question about EP practice was, well, you know, given all this complexity, how do EPs work to support RRBIs in their practice? So we could move to the next slide, please. So I carried out systematic scoping review. Now, scoping reviews are exactly the same as systematic reviews when it comes to the search process, but they really aim to describe a research area, not so much to evaluate effectiveness of interventions. So my search was quite broad. I searched 16 databases. I didn't have any date restrictions, but publications had to be in English. My inclusion criteria were again quite broad. There had to be a diagnosis of ASD. The study had to evaluate an intervention targeting RRBIs, and the age range was 0 to 24 years. I did have a second reviewer, so they looked at a random selection of 20% of reports, and there was 96% agreement between us. This is a summary of my sort of search process diagram, but the number that really matters, I guess, is the one that's underlined. So I ended up with 564 reports in total. So we could move to the next slide, please. This was actually a big chunk of the work in my thesis. So analyzing the reports for questions 1 and 2, because the research literature is so diverse. I was just working with all sorts of different types of studies. What I ended up with was a coding framework whereby I said for each individual study, was a reason given for targeting the RBI? And if yes, did they measure a corresponding outcome? So, for example, if they said we're aiming to reduce behavior because it interferes with learning, did they then implement the intervention and evaluate it in terms of its effect, not only on the RBI, but also on learning? And then I coded the different types of reasons given and also the different types of outcomes that were measured. And with question 2, which was about the views, I obviously had a sort of yes and no category. And if they had reported views, I had 3 codes. So one of them was that there was collaborative decision making. The second one was that some positive or neutral impact of RBIs was mentioned, even if there was also negative impact. And the third category was that they only mentioned negative impact. So could move on, please. So these were my main findings. So with question 1, only 25% of studies stated a reason for intervening, and of those, only 43 measured a corresponding outcome. So it's quite low, really. The majority of the reasons given was a negative impact on structured learning or vocational work, and the next most frequent reason was an impact on social interactions. In terms of views, only 2 studies included children and young people's views, which was really low. 64 included parent caregiver views and 54 teacher views. Now, I haven't presented these as a percentage because it was actually quite hard to know when parents or teachers would have been involved. So there might have been children in residential schools, for example, or children who were home tutored. And also with children and young people's views, there might have been communication barriers, but the thing is those weren't reported. And they should have been, they should have been stated that they tried to access children and young people's views, but for whatever reason, the methods they used weren't suitable. But what I could say is that when they did report those views, they were mostly a short statement of negative impact. So no in-depth exploration of what the meaning of the behavior is for the child or what the function is. And there were only 8 examples of collaboration with parents. And for my third question, which was, were they effective beyond reduction in behaviors? So some studies did state the reason and they did measure corresponding outcome. And I looked at the ones that focused on structured learning because they were the greater number. And there was some evidence that for some children and young people, reducing RBIs did have a positive impact. But I've put a note there that there should, this conclusion is sort of, you have to be cautious because there was a lack of stakeholder views. So we could move on, please. So with my work with EPs, I chose focus groups because I was aware that EPs avoid the diagnostic concept, quite understandably, but I didn't really know how to frame the discussions. So if I were to send out a questionnaire or do some interviews, I didn't really know what language to use. So I thought focus groups would be a better way of exploring that. I ended up with 3 focus groups and had a range of experience, including some senior MPs. And they were really unstructured discussions. So I always started with a question about, do you use RBIs in practice? And if not, why not? And I followed up with an exploration of examples and maybe exceptions. So sometimes I challenged the views that were being expressed. And I analyzed the data with thematic analysis. So we could move on, please. So it'll come as no surprise, really, that the views that EPs express were aligned with the neurodiversity movement. So there was a lot about the language and the diagnostic terms and the narrative that creates, the limitations of diagnosis for understanding behavior, also some very strong views against normalization of behavior, and an emphasis on participation of children and young people in EP practice. But I did feel that actually my focus groups as a method probably wasn't the best methodology to explore practice in depth. Um, so it didn't really answer my question fully in terms of, well, how do EPs work with this complexity around understanding RBIs in their practice? And if we could move on to the last slide, please. So in terms of my, say, overarching question about the research practice gap, if I were to summarize my thesis in a 10-minute presentation, I'd say that the majority of the literature probably doesn't answer the question of when intervention is needed for RBIs and why. And there's been a lot of discussion in the literature about processes of participation to address the research practice gap. But I think I found that there were deeper barriers in terms of developing joint discourse between research and practice. But as EPs, also I've been told in this course, we don't scream in horror and run away. We do this thing called reframing to offer a different understanding of behavior. And in a way, I think that's what I was trying to do with the systematic review, engage with what's there and comment on it and maybe try and change it. Because I think it's also sort of worth pointing out that a lot of the literature that I reviewed was published by practitioners. So yeah, that's the end of my presentation. Thank you for listening.